Miss Wells is a pleasant 28-year-old African-American woman. She presents to the clinic with complaints of shortness of breath and wheezing following a near asthma attack that she had 2 days ago. Diagnosed with asthma at age 2.5 years old, she reports that she was at her cousin's house and was exposed to cats, which triggered her asthma symptoms. At the time the asthma attack onset, she notes that her wheezes were a 6 out of 10 severity and her shortness of breath was an 8 out of 10 severity and lasted 5 minutes. At that time, she used her albuterol inhaler and her symptoms decreased, although they did not completely resolve. Since that incident, she notes that she has had 10 episodes of wheezing and has had shortness of breath approximately every 4 hours. Her last episode of shortness of breath was this morning before coming to the clinic. She complains that her current symptoms are beginning to interfere with her daily activities, and she is concerned that her albuterol inhaler seems to be less effective than previous. She notes that her current symptoms seem to be worsened by laying flat and movement and are accompanied by a non-productive cough. She awakens with nighttime shortness of breath twice per night, and she currently states that her breathing is normal. Her history is that she has been hospitalized 5 times for asthma, last at the age of 16. She has never been intubated for her asthma. She does not have a current pulmonologist or allergist. She is not aware of any environmental exposures or irritants at her job or home. She denies current use of tobacco, alcohol, and illicit drugs. She did smoke marijuana for 5 or 6 years. Her last use was at age 21 years old. She does not exercise. She has had no recent use of spirometry and does not use a peak flow. She does not record attacks and does not have a home nebulizer or vaporizer. Upon assessment, she is alert and oriented and sitting upright on exam table. She maintains eye contact throughout the interview and examination. Chest expansion is symmetrical with respirations, normal feminist, symmetric bilaterally, chest renaissance to percussion, no dullness, bilateral expiratory wheezes in posterior lower lobes, bilateral muffled words with notable expiratory wheezes in posterior lower lobes, no crackles, and no acute distress. In office, forced vital capacity, she's at 3.91 liters. FEV1 and FVC ratio is at 80.56%, and her oxygen, she's currently saturating at 97%. The diagnosis that I give our patient is moderate persistent asthma with acute exacerbation. Due to her FVC and FEV1 FVC ratio and her pulse ox being within normal limits, and using the GINA guidelines, we should begin the patient on a moderate dose ICS LABA, such as Symbicort, 84.52 inhalations twice daily. For her reliever inhaler, she can use the low dose ICS formoterol combination, such as Dulera.